And good day. Welcome to Code of Ethics Overview Supervision with Dr. Latasha McElwain. Today, we're going to follow up with part two of our Code of Ethics, ACA Code of Ethics review. And of course, going back to the ACA Code of Ethics, of course, the mission of the American Counseling Association is to enhance the quality of life in society by promoting the development of professional counselors, advancing the counseling profession, and using the profession and practice of counseling to promote respect for human dignity and diversity. The American Counseling Association Code of Ethics contains 9 main sections. In part 1, we discuss section 1, the counseling relationship. We discuss section A, the counseling relationship. And then we discuss section B, confidentiality and privacy. And then we also went over section C, which is professional responsibilities. Today, we're going to jump into relationships with other professionals, which is section D. We're going to also look at section E, evaluation, assessment, and interpretation. And we're also going to look forward into section F, which is supervision, training, and teaching. These areas help us to round out many of the concerns and questions we have in supervision along the lines of professional development and also being in practice. So we're going to jump into it. And then in our next video, we're going to look at the final 3 areas, which would be section G, research and publication, section H, Dustin's counseling, technology, and social media, as well as section I, resolving ethical issues. Okay. All right. So starting with section D, relationship with other professionals. So professional counselors recognize that the quality of their interactions with colleagues can influence the quality of service provided to clients. They work to become knowledgeable about colleagues within and outside the field of counseling. Counselors develop positive working relationships and systems of communication with colleagues to enhance services to clients. All right. So we're going to break this down and kind of talk about our professional relationship with other professionals. So, as professional counselors, we do want to make sure that our interactions with other counselors and other colleagues in this field is of good quality so that we are able to provide great services. And a lot of times I like to break this one down and talk about collaboration when we're collaborating with other agencies, other providers, and other professionals in regards to, what we can actually do, what we can actually help provide, things we can actually help our clients with, and be able to advocate for them in certain ways that are going to be positive to their overall outcome. So with that being said, we just want to make sure that we have good professional relationships with others. And definitely, I think when tough times come up, like when we're sitting in case staffings or we're sitting in treatment team meetings, that we are trying to make the best possible outcome. And we are laying out there what could be, I guess, barriers to that person being able to get to those successful outcomes by being able to present that information to the team so the team understands what your concerns are and why you have those concerns. So a lot of times that is something that comes up. So our interaction with our colleagues, I always tell individuals that, don't get me wrong, we're very passionate about what we do, but we have to be willing to collaborate and work with other professionals to be able to, see a better outcome for the client, patient, for the most part, we got to make sure that we're putting together a good plan, a good, if it's discharging, a good discharge plan, if it's treatment planning, a good treatment plan. And we have to really make sure that we set aside sometimes our level of passion may get in the way of, or could become a barrier for us making sure that that person gets the right service because we're looking at things that we feel. So a lot of times I always tell people that's where we have to make sure that we're shaking out our beliefs and our values with certain things that are personal and make sure that we're staying along the lines of the professional need for that particular client, patient, individual we're working with in any situation. So going to the next one here, we're going to talk about the work, of course, as we are working in this field, that we're becoming more knowledgeable about our colleagues and, inside and outside of the professional counseling field, but also in other areas as well. So we want to be knowledgeable about some of the things that, some of our collaborating organizations or collaborating agencies, what they do and what they kind of don't do. I always tell individuals, if you don't know what specifically an agency or that department within that agency do, asking and becoming more knowledgeable about what they may do. Here in the area where I work, there are a few hospitals, and in the emergency rooms, there are certain things that some hospitals will do versus because they have the resources to do it versus what other hospitals would be able to do because they may have limited resources or their resources are going in other areas. So they don't necessarily address that particular concern that's come up when we're talking about discharging, treatment teaming, doing the CFT team meetings for our children. We are making sure that we understand that every agency may have a different way of doing things. I always like to say that you may see social work in one hospital doing one thing and social work in the other hospital doing something different versus the behavior health access team doing one thing in one hospital and then in another hospital they're able to do so many different things because they have that more range to do additional outreach or additional promote additional resources in the community and able to make those connections. So I always tell individuals, you want to know specifically DSS. You want to know kind of what DSS would do. And, sometimes there will be some outliers that will come about where, they will provide something that they normally don't provide because maybe the NCO, the LME, or the insurance company is requesting something more. So with that being said, there are times when things will come up and there will be some outlier type situations. So being knowledgeable of the colleagues and the different types of agencies and what those agencies do, what those agencies are able to do, can't do, can do, might be able to do if it's extenuating circumstance. So a lot of times being knowledgeable about things like that is always great. And I definitely can't forget talking about the criminal justice area, knowing what the probation officers can do. I used to be a probation officer. A lot of times I'm able to tell people, I know that probation can do this, and I know that probation cannot do that. However, I've been gone for over 20 years, so I will call one of my colleagues to find out what is suitable or what can be done in a scenario like this. Of course, talking with that colleague using general terms, not necessarily talking specifically about that particular client situation, because that would be, a HIPAA compliant, not being a HIPAA compliance and sharing that information. So basically being able to sometimes get information from other colleagues that in the area, in the field is always good as well. Like I said, just kind of talking through things with, non-identifying terms and non-identifying situations of your particular client, but definitely being able to, find out, oh, can you guys do this? Do you guys have some extenuating circumstances where you have some funds or you have some resources that can be available and we can, be able to utilize. So, a lot of times, that comes with being able to work with your colleagues in a way that maybe you might go up the chain of command and be able to get something different happening than, like I said, normally would be happening. It could be an outlier type situation. So, I always tell individuals just being aware of the other, I can call them maybe stakeholders in the situation with a particular client, all the agencies involving the situation with that client, as well as just being able to collaborate. So knowing, being knowledgeable about colleagues, their agencies, and what can and cannot be done, and also being respectful when we're asking if something can be done or we can look at something in a different way. Counselors also develop positive working relationships and systems of communication with colleagues to enhance services for clients. So that really kind of go back to what I just talked about being knowledgeable, but also being able to work through things. Again, I'll use the last little comment that I made about, it might be a situation where I can discuss it with an agency and they can say, okay, well, in a scenario like this, we have to go up the chain of command. And, if you find out that information, it's not, it'll be great to utilize it. But if, say, I say that with probation, I say that with the sheriff's department, I say that with, other agencies, CMPD that I have worked with in my area. And a lot of times with working with them, I've been able to talk not only to the identified officer involved, but also be able to call, because I've got a relationship with working in criminal justice and law enforcement prior to coming into counseling. I can call a old officer that is now a chief, or an old officer that's now a lieutenant, or someone that's now a captain, and kind of talk them through the situation, not giving identifying information, but kind of our concern and what we're trying to do, and how they can be a support to us and we can be a support to them in order to support a particular client in a certain way, but understanding what their quote unquote chain of command is and how I can get to the top and find out if that is even something that we can actually be able to, pull together and, create a better outcome for, success for that particular client. So a lot of times, like I said, just having a good relationship, I think that's something to really be focused on in the field. That's one of the reasons why I love this field, and I still love the law enforcement criminal justice field, is because there is a lot of collaboration and there is a lot of talking going back and forth. So I really love the fact that I've been able to round my career out and not necessarily forget the first part of my career when I started in criminal justice and law enforcement, and still kind of pull that in with the mental health side of things. So that's a great asset, of course, to me. So yeah, so definitely having the relationship with your other professionals, that is something that we really, really focus hard on. And we want to make sure that we are, following up and honoring requests that they're requesting of us, things that we can do. Of course, being able to be respectful, as well as understanding when we find out that they can't do something, or that we can or cannot do something based on our management level telling us that we can't do certain things. We definitely want to be able to, again, honor and respect whichever answer we get, and be able to work forward with those agencies still to try to come up with an outcome that's going to be successful, or at least be at a point where a patient or a client is able to see that there's a plan, and then allow them to go out there and do what they have to do with the support of these agencies. And if it is a unsuccessful, tour of duty, then we'll bring them back to to the drawing board. And I think all the organizations would come together and realize, that wasn't a sufficient plan, or that plan just didn't work, but we needed to see if it would work or not. And now that we know that it hasn't worked, then we can definitely follow up with some additional supports in order to make sure that we can, set this particular patient, this particular client up for a more successful outcome. So that's all about the professional relationship with others, with other professionals in the field, and of course outside of the field as well. The next one we want to talk about is Section E, which talks about evaluation, assessment, and interpretation. So counselors use assessments as one component of the counseling process. So we definitely focus on assessments, taking into account the client's personal and cultural context, and also when we talk about the personal and cultural context, we want to make sure that we are, again, like sometimes I tell some of my colleagues, as well as, remind others as well, that I totally understand that all of us are on the same page and thinking this, that, and the other. But we have to also be very considerate of that individual's personal context and their cultural context, as far as saying that this will be a great plan for them. And they're saying that they don't feel that they would be able to you know, um, go through or handle or be able to accept what we're kind of bringing to the table because of those personal and as well as those cultural, concerns and issues that come up. So we got to be very, very aware of that, as well as understand the sensitivity that goes behind it. So counselors promote the well-being of individual clients and groups of clients by developing and using appropriate educational, mental health, psychological, and career assessments. So basically, when we're talking about that, we want to make sure that we're using the correct assessments, evaluations, and that we are interpreting the information that we are receiving in a clinical assessment, a career assessment, a psychological assessment, or even in my current position, or one of my current positions, is also a psychiatric assessment or evaluation. A lot of times, when we're doing our mental health clinical assessment, we are definitely, figuring out what's going on and getting the patient, and we get the collateral, which is the family members or the girlfriend, boyfriend, husband, wife. We're getting that information from, and even mom and dad, we're getting that information from them firsthand, so we can be able to sit down, continue the evaluation part of it, make sure we're assessing appropriately. Of course, we're staffing the case as well, and then the interpretation of what we're getting from the clinical summary that we've come up with at the end of the assessment. We are trying to make sure that it's the most appropriate information that we're getting from them. So that's why we get different, viewpoints from everyone, like the family members, and of course, from the patient, also the client, also, and then also being able to educate family members and patients and clients on some of the appropriate ways to handle things. Just being able to educate them on, some of the most, I guess, better tools, or better, put some tools in their toolbox to help them be able to understand what's going on and what some of the next steps will look like in, kind of moving forward. And then again, the psychological or the psychiatric assessment also goes into, in my particular position, the psychiatric assessment. We have to be able to work with our psych team to be able to come up with some of to staff the information, so everyone will kind of know what's going on, but also to be able to come up with what the plan is going to be, what the plan of care is going to be. The plan of care for us is pretty simple. We're not going into great detail about it. We're just looking to figure out whether a person is able to go outpatient with resources, and whether they have services wrapped around them. And then we're also sitting to make sure that we can make a plan for inpatient. We don't go in depth in the inpatient care nor the outpatient care, but we do tell them, what the next step would be, as in, okay, you're going to go inpatient, and going inpatient, you will link up with our inpatient team, and our inpatient team will carry it from there. In the meanwhile, we'll be looking for a bed for you, either on our unit or on another unit, wherever that unit may be across the state. But we're going to be looking for that bed for you. So that's kind of the end of our, assessing part, and then making sure that we're getting the appropriate level of care. And we're also educating the patient, the family, the client, however you want to say it. We're making sure we're educating everyone, that everyone's on the same page and know what's going on. When we're talking about career assessments and other assessments, I can also talk a little bit about domestic violence assessments as well as substance abuse assessments and the anger management assessments for the most part. When we're doing those, we are wanting to use definitely the appropriate assessments. We want to use the appropriate tools out there. There are different types of career assessments that you can definitely use. In my current positions and the things that I do, I don't do a whole lot with career assessments, but I do a lot with professional development, which is kind of the aftermath of, okay, what is it that you really want to do and how we're going to get into it, and what's the developing process, coming up with a plan of action for what that professional development will look like for all of my supervisees and my interns that come through my programs. And then when you look at a domestic violence assessment, that is an assessment where you are assessing someone because domestic violence has been a part of their history, or is, things are ramping up. So it could be a potential part of what's going on with them that, we look a little bit deeply. We do have a domestic violence assessment that we use. It definitely is similar to a real clinical assessment in my state. It's definitely kind of equivalent to a clinical assessment, but there are more questions that go around with the relationship, which really is some of those questions that you can pull out of some of the when you look at marriage and family counseling, or marriage and family therapy. A lot of those family type questions are more so on that domestic violence assessment. And so it goes into great details about that. It do ask a lot about a person's mental health status, substance use status, and all this other stuff as well, to make sure that we get a full round picture. I guess the biggest thing to say is, even if we're doing whatever type of assessment we're doing or evaluation we're doing and interpretation of it, we are looking at the full picture. That's what we're trying to get. And we're trying to make a clinical assessment, a clinical summary, or we're trying to make um, a clinical judgment on what we're seeing, so that we're able to staff the case further with different professionals as well as different disciplines, so that we'll be able to get the point across as to what's going on, particularly with that patient or that client, or again in group therapy as well, that we're looking for the best appropriate tools to use, the appropriate way to educate the group, as well as, when we're looking at, again, anger management and substance abuse. Yes, there's some mental health pieces in there with both of them, but there's also some substance abuse pieces in there. In anger management, there are pieces that, come out asking more things about your the behaviors that you display, and some of the issues and concerns that come out of those, behaviors, the history of those behaviors, new behaviors, and things of that nature. So all of that is talking about making sure that there is a specific or a rule of thumb when we're talking about evaluations, assessments, and interpretation of those assessments. I always like to tell people evidence based is the biggest part of what we're looking at when we're looking at these assessments, to make sure that we're able to focus on what is needed. So again, in most settings, I would tell people that when we're thinking about assessments, when we're working with patients, clients, students, it doesn't matter, supervisees, whatever the case may be, when we're providing a level of service as a counseling professional, we are going to be looking at the fact that every day we see that client, that patient, that student, that supervisee, that whomever that we're working with, in whichever level or whichever manner we're working with them, we are looking to assess. So if we have, let's say, students coming into a day treatment every day, we are going to really look at doing a overall assessment of that child every day, of those children every day. When they come in, are they sad? Are they upbeat? Are they happy? Are they, are they, they look at they're contemplating something? Are they, kind of moody today? We're looking for that. We look for that when we look at our clients when they come in for their individual session every day or not every week. We're looking at what their mood is like. We're looking at what's happening, what's going on. We're assessing those things. We're also looking at that, when individuals come into Um, if it's a supervisee, I'm looking at that when they come in for their supervision session. So when we look at evaluations, assessment, and interpretation, it's in whichever area you're working with an individual, you are making sure that you're taking notes. Basically, you're making some things I tell people, kind of that's a notable fact right there, that little Cindy has come in every week with some concerns, every day this week with a little bit of concerns, and it could be the same concern or a different concern every day. So we do try to assess every time we see a patient, a client, a student, the individual we're working with, because it can change from day to day or from week to week, and we want to be able to note those changes, especially if they're notable change, like something seriously happening or going on or different about that individual. This is how kind of we learn our baseline on our patients. We start to realize, oh, she's usually happy, then all of a sudden she went down the dumps real bad. We start to realize what our baseline is for our patient. Or normally she's kind of, she's okay. She's not always happy and she's not always sad, but that's kind of her baseline right there, right in the middle. But this week we noticed that there was a boost in her happiness, that we might be looking to make sure that she's not going into a manic state. So again, we definitely want to make sure that we understand what we're focusing on when we're thinking about the evaluation, assessment, and interpretation, and making sure that we are able to, we're making sure it's in the counseling process, which, like I said, is one of the biggest component, of course, but it's in the counseling process, and we are, taking account of what is going on with our clients, not only what's going on with them, we're also making sure that we understand what the personal and the cultural context is for that particular client, because everyone's going to be different. It's not a one check one box and it fits all. No, everyone's going to be different. And then, of course, just promoting the well-being of our clients, making sure that everyone feels comfortable, they're on the good foot, are on the same page, and we can move forward, and everyone will be getting what they need out of the counseling session, group session, students in the classroom for a day treatment program, individuals in the group home for a residential program, that we're making a fair share or a fair go of things, and we're able to do so in the most productive and effective manner possible. So that's what we're talking about when we're talking about evaluation, assessment, and interpretations. Um, Next, we'll move on to Section F. And Section F is about supervision, training, and teaching. So counselors are, supervisors, trainers, educators. They aspire to foster meaningful and respectful professional relationships and to maintain appropriate boundaries with supervisees and students in both face-to-face and electronic formats. So they have theoretical and pedagogical foundations for their work, have knowledge of supervision models, and aim to be fair, accurate, and honest in their assessments of counselors, students, and supervisees. So this section F, supervision and training and teaching, talks about how the counseling professional basically works with other individuals, making sure that they're maintaining their appropriate boundaries. They're also being respectful of the relationship, and that they make sure that they provide this level of care, even if it's face to face and if it's electronic format. So if you're emailing, texting, or definitely being able to do your Zoom face to face format, on an electronic device, then we're also making sure that we're totally being, meaningful, respectful, and maintaining appropriate boundaries. The next part, talking about, the different parts of what we're doing. Yes, we want to make sure that we have foundation to our work. We want to make sure that we are, coming up with things that are quote unquote evidence based we want to make sure that we are focusing on our work in that way, and that we have the knowledge of what we're actually working with. So basically, I always tell people we don't want to practice outside of the scope of our practice. We want to make sure that we're practicing within. So a lot of times when I'm in a hospital setting, I'll tell individuals, they'll say something about Adderall, XR or something. And I'm looking at them like, I do understand what Adderall, what it is and what it does and everything else. However, I am not a medical profession in that level, in that sense, in that form. Therefore, I know it's a medication that we use for ADHD, but I don't know how many milligrams. I don't know how many. I cannot elaborate on any of that. And normally, I usually push that information back to the psych doctor, or I'll push it back to the psych AP, or I'll push it back to the nurse to make sure that that is, something that is being communicated accurately. I typically will take the information of, oh, he's on Adderall XR 3 milligrams. And then I will carry that on to the psychiatrist and they would handle it from there. Medication is not, my realm is not within my scope of practice. So I, stay on the sidelines when it comes to that. That's even when people ask me about a person's blood pressure, a person, being a diabetic and different things like that. No, I don't have a lot of, I have some knowledge around it, but I don't have the specific knowledge in it to be able to address it. So staying within your scope of practice and knowing that you have the foundations for what you are totally working with. Again, having knowledge of supervision models, that is something that I have to have because I am a supervisor. And I tell people, being a counselor, we have to be mindful of our theoretical foundations, models, all those good stuff. We do need to be aware of that because that's what we do, and that's practicing within our scope of practice. If I was just a regular counselor and I didn't do supervision, I wouldn't be able to talk to someone about supervision that much, except the fact that I probably have supervision and this is what my supervisor worked with. But now that I am a supervisor, then I am a person that can talk to you about, the different models of supervision, kind of supervision styles and different things like that, because I've done, it for quite some time and I've learned it. In order to be a supervisor, you have to have a certain set of courses and number of hours in order to, be listed as a clinical supervisor. So again, being able to know what, staying within your scope of practice, again, aiming to be fair, accurate, and honest with the assessment of, what's going on with the individual. So, we really want to make sure that we making our, I always tell people, our professional opinion versus our personal opinion. But our professional opinion is what we can back normally with justification, and we can back with some theories and some other, things to make sure that the person know that we are working from an evidence-based model and that we are just not pulling something out of the air or playing off the fact that we are having personal feelings about something. And that's one of the things that I always try to stress to my colleagues, individuals that work for me, individuals that work under me, individuals that call me for whatever level of advice there. I try to make sure that I help them understand that professionally, this is what we're doing. Personally, I hear your thoughts and I hear your concerns, but on a professional level, we have to maintain that. And a lot of times I tell people, if you get involved in something and you feel like your personals are too involved in it, I like to tell individuals sometimes backing out of a scenario or a situation is not the worst thing in the world. That's just helping to protect your professional integrity and who you are, and making sure that you're not, blurring the lines. I tend to tell individuals that because I have personally, I have sons with special needs. Depending on what's coming into a setting or what's coming into mainly the hospital. In my private setting, I can usually handle things, but in the hospital setting, because there's so many rules and guidelines that I have to maintain, not just working from the ACA, code of ethics, but also working from being a counselor and then being under the hospital policies and things I can and cannot do. If it becomes too much of a situation for me, I have very good boundaries in place where I will automatically tell them that I wouldn't be able to see a patient, I wouldn't be able to move forward, going forward with this particular patient for whatever reason, and I give my personal stance and my personal reason, and professionally see my way out of that scenario. So when there are things going on, for instance, a day treatment program or a residential program, I work in those areas also. If you notice those things are happening and going on, then you need to professionally let someone know so you can see your way out of that situation, or be as cordial as possible, by removing yourself versus being involved and getting all personally entangled with all these ideas that you may have, or your beliefs and your values really over taking the scenario, when it's really the personal beliefs and the respect that we're supposed to have, the dignity we're supposed to be upholding for our patients, that human dignity we talked about earlier. We have to make sure that we are, uh, being all honest with ourselves, very fair, period, and accurate, and again, honest, in order to make sure that we are looking for the best outcome for that particular scenario, that particular patient, student, counselor, supervisee, whatever the case may be, resident. We want to make sure that we are putting our best foot forward, and that we're not held, liable for any negligence or anything of that nature. We want to make sure that we're doing our job with the utmost respect and level of dignity possible. So again, that's kind of talking about supervision, training, and teaching. We want to be, again, fair, just, honest, and make sure that we're providing a productive, again, effective communication atmosphere, environment for everyone to gain what they came to gain from the scenario, the situation. Okay, so we're going to move along here. Those were the three areas that we covered. Again, resources, we're taking this information straight from the ACA association. The ACA Code of Ethics. We're taking this information directly from the American Counseling Association. So we just want to continue to encourage counselors to work from the best scenario possible for themselves and for the patients. And we always want to put our patients first. But again, like I said, if you are not comfortable in a scenario, then, respectfully, you have to understand how to bow out gracefully and make sure that your patient is not harmed by anything that you may have going on. That's one of the things that we do talk about in supervision as well, is that if you're coming in with a really bad day, today might not be the day to come in if it's going to be a real not so great, whatever happened at home, or whatever happened on the way taking the kids to school this morning, or your, child may have got put off the bus this morning, whatever the case may be. We want to be able to make sure that we are managing ourselves appropriately, so that we are able to work with our clients, patients, students, supervisees, and individuals. Again, that we are making sure that we are focusing wholeheartedly on making their scenario and outcome successful. Again, and I say that because, like I said, we could be having a real bad day or a real bad week. A lot of times, and I'll give a short story here, that as a counselor, I can remember going through some rough times when I first started, rather it be that my practice is not making enough money, or we're not billing enough, or whatever the case may be, or we're just not hitting the bottom line. That was something that affected me sometimes starting out in my own practice. And so I did work on how to get me to a better state. And when they became some awful times where I felt like, oh my gosh, I can't get out of the bed today. that's when I felt like I was struggling, and I would automatically put myself on standby for my patients by letting them know that I'm a little under the weather right now, and I want to take a week off to take care of whatever I have going on, whether it really be truly sickness or it's really my mental health or things like that being compromised a little bit by so much stress that I had on me at that time. I would take a week off in order to focus. I would make sure that my patients or clients are, able to make contact with someone else in the practice, but I would need to take a week, a mental health week to take care of me. So I'm just being, I usually tell people I'm being realistic, as in it takes a lot to be a counselor. It takes a lot to be in this profession. So when you're having moments like that, take a day. You need to take that time before you get in there and hurt someone else or harm someone else in some way. You know, we have to be mindful of that. So I tell people a lot of times that, as a counselor, you have to check yourself every time you walk through the doors. You have to check yourself to make sure that you're focusing and doing the best, and able to put your best foot forward. And if you can't pull your personal scenario or situation out of what just happened, and then you have to go work with others, then it might be best not to go work with others. Take a break and do what you have to do for you, and then follow up later with resume when you're at a better state, because again, that can cause a lot of harm to our clients, our patients, our students, our residents, our supervisees, the whole gamut. We can really cause some harm to other people that, of course, they weren't expecting. We weren't expecting for it to happen, but we also knew that we were walking in at a disadvantage because we weren't feeling our best professional self because of whatever was going on personally with us. So I do try to help everyone to understand, and make sure that I'm getting it across that yes, you have to take time for yourself, because this is a very rewarding field, but a very stressful field when it comes down to all the other things that we hear and that we work with other individuals. So with that, we'll follow up again with another video, and that video would be talking about, of course, the ACA code of ethics, and we'll be finishing up the last part, as in the final areas, the sections that we'll cover. And until then, like I said, just make sure that you're always making sure that you have everything intact when you walk through the door, and that you're ready for the day ahead. And at any time you feel like you're in a disadvantaged situation, then ask for the time to be able to step away to take care of you before you do any harm to any other individuals in the scenario, in the situation, or at your job, or whatever the case may be. With that, we will follow up with the third video, and I'll see you next time.